So if you're joining the stream, you're welcome. This is Work and Wonder. My name is Enos, and today I'm coming online because I've gotten up to 1K subscribers, and then as I promised, I said if I get up to 1K subscribers, I would go live. And then if anybody has any questions at all, I'll be answering more of the questions, and then I'll also be doing more or less like an overview of the whole mental health. Osce, I know there are a lot of people who are, they are not yet in the UK. A lot of mental health nurses that are not in the UK, and they want to come into the UK to come and take their OSCE. Most of them now, they want to come in and take their OSCEs as self-sponsorship route. And the fact of the matter is that it's unlike um, the adult nursing OSCE, which has a lot of materials online, unlike that in with the mental health OSCE, there are not a lot of materials. So if you look online, you'll see that my videos are among the few ones that you can find online. Most of them are on adult nursing. And I've had a lot of questions from a lot of people across the world, from all different countries. Those that are especially very much interested in coming to work in the UK as mental health nurses. So if you are joining the live now, it was supposed to start at 10, but then I'm still trying to get one or two things together. And then don't hesitate to put anything or any question in the chat. Just pop it in the chat, and of course, I'll be able to see it. But then I just want to confirm if those that are on hear me. If I speak, can you hear me clearly wherever you are watching me from? If you can hear me clearly, you can just pop it in the chat as yes. And then I know that at least people are hearing me. I'm trying to get my phone so that I log on to see whether I'm live and I can hear myself. Great, great, great. I can see somebody saying that you can hear me. So I'm guessing everybody can hear me. So if you are just logging on, you're welcome. This is a live section with me, Enos, and this is Work and Wonder. Um, this is a section to appreciate all of you for, um, you know, subscribing to the channel and then sharing my videos to other people for them to see. I'm very much appreciative of you doing that. And then I'm also going to run you through the mental health OSCE. It's just more or less like an overview. We'll just go through it right from skill or station number 1 to station number 10, and then we will know what it entails. And one thing I've also noticed is that a lot of people are giving out false information to people that are yet to come into the UK to take their mental health OSCE, especially those that are coming in as self-sponsorship. A lot of false information about the mental health OSCE. People are always confusing it with the adult nursing. There are so many things that they do in the adult nursing that you cannot find in the mental health OSCE. The mental health OSCE is very, very, very simple. Very, very, very simple. So I'm just waiting. When it is 10 o'clock, we would start to have an overview of that. But then in the meantime, if you have any questions please don't hesitate to put it in the chat box, and then we will look at those questions. And then some people will also be joining. They watch the videos, and um, that was just pretty much it. Most of them just came in. They didn't go for any class. They just watch the videos, and through practicing, they've been able to pass. So if you are thinking of coming in as self-sponsorship, it doesn't matter, whether you go for tuition or not. It's just a matter of having information, and every information you need on the mental health Osce is on my channel. Every single information you need is on my channel. So please make sure you always log on to the channel. I have a lot of videos that I'll be posting because I've had requests from quite a lot of people. They want me to do videos on some specific stations, and I'll be doing that as well. But then, yeah, so continue sharing to other people. If you are just joining, please share to other people so that they can also join. And then I'll start it. I'll start in the next 4 minutes. I'm going to start it. Yes. So I'm still waiting for people to join. I'm still waiting for people to join. And then the next 2 minutes, I'll start um, I'll start the whole conversation. So it's all about the mental health Osce. We are going to look at an overview of the mental health Osce, what the mental health Osce entails. And then we'll just look at some questions that a lot of people have been asking. I'll also be answering them. I've written them down, so I'll also be answering those questions. And if you're following and you have any questions that you want to ask, you can also ask, or you can just pop it in the chat section. And of course, I'll be more than willing to answer that. Yes, so I think it's just 1 minute to 10, so I'm going to start. Yeah, so obviously, all of you know me, especially I'm guessing that all of you here or those that have joined are mental health nurses. So in the UK here, there are so many pathways in which you can practice here as a nurse. We have the mental health nurses, we have the adult nurses, we have the learning disability nurses, we have the children nurses, and then we have the nurse associate. So if you are coming into the UK to come and work as a nurse, these are the pathways. But then the one I am here is a mental health nurse. And if you want to practice here as a mental health nurse, obviously you would have to take the CBT, which is more or less like the theory part of the whole NMC exams, which you take in your country. So if you are taking CBT in your country, it has to be mental health, all right? Now, if you take the mental health CBT and then you get into the UK, the second part of the exams before you'll be able to get your PIN and you will now be fully registered here as a mental health nurse is the OSCE, all right? It's the OSCE. And because you're a mental health nurse or you did the mental health CBT, when you are doing your OSCE, it is going to be the mental health OSCE. And after passing, you will now be registered here as a mental health nurse in the UK. Now, I know there are some people who are not mental health nurses back home, or they are not registered mental health nurses back home. They are like general nurses. And some of them have written the mental health CBT. And then when they come here, they come and also take the mental health OSCE, and now they are mental health nurses. It's just a matter of your registration with the NMC. The NMC doesn't have any problem with you being a general nurse and then you writing the mental health CBT. So far as you're able to pass and then you register with them as a mental health nurse, so far as your home country clears you, they are more than okay with it. I've had a lot of people that I've taught, they don't have any background in mental health, but then they did the mental health CBT, registered with the UK NMC as mental health nurses, and now they are in the UK. They've passed their mental health OSCEs and they are working as mental health nurses. Yes, so before we even go on to the OSCE itself, in the UK, if you want to work as a mental health nurse, there are so many specialties and it's very, 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 very interesting. We have for acute, We have the acute section, we have forensic sections, and even in the care homes, we also have them. We have neurology sections, we have neurodiversity. So when you come into the UK to work as a mental health nurse, there are so many areas in which you can work. Even in the prisons, some prisons recruit nurses and then they come in and you are just basically in the prisons there with the prisoners who have mental health issues and are on some psychotropic medications. You just be there. So continue pushing. If you've not had a job and you are thinking of coming to do the self sponsorship, continue pushing, come in and come and take your exams. And then once you are done with your exams and you have your PIN, there are so many opportunities here that you can apply for. You get a job, go back home, and then you come in as a mental health nurse. Now let's now look at the mental health OSCE in general. All of you know that it's just similar to the adult nurses. There are 10 stations, and you need to pass all these 10 stations before your PIN will be issued to you here as a mental health nurse here. And with the OSCE, one question that people have been asking is, can I use 1 week to prepare? Can I use 2 weeks to prepare? It is entirely dependent on you. If you are very, I've had somebody who used 1 week, we just used 1 week, and then that was it. The person was able to pass. So it's all dependent on you. How long you think you'll be able to study all the 10 stations, and then you go and take the exam. So it doesn't matter the duration in which you are using to prepare. You can prepare for 6 months and still fail. Somebody can prepare for 2 weeks and go and pass. But one thing I have to tell you is that the mental health OSCE is the cheapest. In fact, it's not as difficult as the others, like something like the adult nursing. That one, there's a whole lot that you have to read, and it's still limited to 10 stations. But with the mental health OSCE, there is less to read, and it is still 10 stations. So let's start off with the API station. The API station is the assessment, the planning, the implementation, and then evaluation. In the mental health OSCE, I'll take them one after the other. When it comes to the assessment, there are just two phases in which you would be assessing. When I say two phases, what it basically means is that it's like two conditions that you'll be assessing. So you are either going to meet patient A with that condition, with A condition, or you're going to meet patient B with B condition. And it is simple. It is depression phase and then the manic phase. So if you put them together, obviously, if you're a mental health nurse, you know that that is bipolar. So either you're going to meet a patient who has depression, mostly with suicidal ideation, which is one phase, or you are going to meet a patient who has mania. These are the only two phases, or these are the only two patients, or the only two conditions that you will be assessing. So some of you are like dementia, you are mentioning all sort of, I know that there are a whole lot of mental health disorders, and NMC, they know when it comes to conditions like schizophrenia, like schizoaffective, those are like big conditions that you cannot use 20 minutes to assess. But with depression and mania, it is kind of very easy for you to do an assessment on that. That is why they have limited it to either you are meeting a patient who has depression or you are meeting a patient who has mania. So please, nothing like dementia, nothing like schizophrenia, nothing like psychosis. Don't waste your time on them. Mania or depression, these are the two patients that you will be assessing in the assessment station. And in the assessment station, it's all about talking. It's all about talking. You have a whooping 20 minutes to finish the assessment station. All right. So far as you know how to talk, you know how to ask the relevant questions, you are good to go. And the whole assessment is focused on the fact that you are going to meet the patient. The patient has problems. You assess the patient to be able to come out with these problems, and mostly the problems comes with some risk factors. So assess the patient, know the patient risk factors, know the patient problems. Once you know the patient problem, then of course you know the interventions that you would be able to put in place to help this particular patient. So that is all everything about the assessment. Just that when you are studying, there are some things that are very specific to mania, and there are some things that are also very specific to depression. But in both phases, you are assessing the patient, you are looking out for the risk factors, you are looking out for the problems that comes with these risk factors, and of course, the interventions that you'll be able to put in place to help this patient. It's as simple as that in the assessment phase, and you have 20 minutes to finish. Here, you are giving a patient. So you are giving a patient who you are going to sit with, you are going to talk with. And trust me, these patients are very, very, very good actors. So if it is depression, you go in and then they are seated that way, they look depressed. In their face, you can see they look depressed. The way they talk slowly. You know, they really, really look depressed. And if the patient is also manic, when you also meet the manic phase, they are also very, very, very manic. Sometimes they are just busily writing. Whilst you're talking to them, they are writing. At a point, they can even get up and ask you, do you need me to make you a cup of tea? You know, they just act as if either they are manic or they are what? Depressive patients. So these are the only two phases in which you would be assessing, as I've said. It's just risk factors and then the problems. You are finding the problems associated with the risk factors because when you go to the next stage, which I'm going to, which is the planning, whatever problems that you were able to discover from your assessment, you are going to choose two of them. Trust me, you will find more problems when you are doing your assessment. You are going to find about 4 or 5 problems, but out of these 4 or 5 problems, you will need to prioritize two of them, and then you use that to draw a care plan in your planning station. So after assessment, you come and then you come and do your planning. You use 2 problems, you prioritize those 2 problems, and now you use them to draw your care plan. Most of the times, those 2 problems, we have what we call actual problems and what we call potential problems. Actual problems are problems that the patient is already experiencing. Something like the patient is experiencing low mood. That's an actual problem. The patient is having sleep difficulties. That's an actual problem. But when we talk about potential problems, they are like risk for malnutrition. The patient is not malnourished yet, but then if nothing is done, then the patient can be malnourished. Or there can also be risks for self-harm. The patient has not self-harmed yet, like attempted a suicide yet, but then if nothing is put in place, the patient can easily, commit suicide. And then, so yeah, basically that is it. An actual problems and then a potential problem. Then you are going to do your care plan. And in the planning station, you have 14 minutes to complete these 2 care plans. The planning station is a silent station. When we say a silent station, you don't have to do anything for the examiner. You don't have to demonstrate anything for the examiner to see. You just have to sit down. When you go, you sit down, they give you your paper, your scenario, and then they are going to also give you your answer sheet. All you need to do is to remember 2 problems you got from the assessment, and now you use that 14 minutes to complete those 2 care plans. Remember 14 minutes that you are using. So 7 minutes each for the 2 problems. One thing I always advise people is that try and always use at least 12 minutes in practicing or even 11 minutes in practicing in finishing all those 2 care plans. And when you get to the actual exams, you'll be able to finish in time because you might think the 14 minutes is enough, but then some people tend to waste a lot of time on the very first care plan. So they finish the first care plan and then they've used about 9 minutes. Now they realize that they have less minutes to do the second one, so they kind of rush. And when you are rushing and you are not careful, you can draw a care plan which doesn't really address the risks or the problem that you have stated as is the patient problem, and you can fail with that. So yeah, keep that in mind. Now we'll go to the next one, which is the implementation. Implementation is just basically administration of medication. All right, administration of medication. So here you are given a scenario, and then they give you a time which you'll be giving the medication. So they will always state a time. So it is give 12 o'clock medications, give 8 o'clock medications, give 7 o'clock medications. And then these are the medications that you would, and then there'll be a list of medications that you'll be given. But in the UK here, you don't just pick the medications and then you give them. Even if the medication has been prescribed, you have to make sure that that particular prescription is valid, it is correct. So when I read a prescription and, for instance, there's something that needs to be there for the prescription to be valid is not there, then I cannot give that particular medication, because if as a nurse, as a mental health nurse, I give it and then anything happens, they are going to hold me responsible for that. And as mental health nurses, we also know how there's some of the effects of our psychotropic medication. Some of them can be very, very fatal. So you have to make sure that the prescription is valid, it is correct, it is legible before you'll be able to administer it. First, I used to have a lot of students who used to fail the implementation, and it used to be the most failed station in the mental health Osce. But now things have changed. People are rather failing evaluation, they are rather failing assessment. I don't know why the turnover, but then because people used to fail the implementation a lot, people are now putting a lot of effort into the implementation. And now when they get to the other stations, they rather fail those stations. So when you are studying, make sure that at least you give equal attention to all the individual stations, because if you even fail one, you've not they are not going to give you your pin. You have to come back and then come and write it. So yes, just administration of medication, and it can be in a community setting, it can be in a hospital setting. When we say community, in the UK here, one job that we have here is CPNs, which is the community practitioners. So if you're a mental health nurse, you can either be based in the community or you'll be an inpatient mental health nurse. Inpatient is like you are basically with the hospitals, you have a ward, and then you go to your shift, you attend to your patients, weekly basis and all of that. But when it comes to the community or CPNs are in the community. They normally have a base like a community office or a community clinic, and then they are giving patients. So they call them workload. So if I am a CPN or I'm a community nurse, I can have like a workload of, let's say, 20, which means I have 20 patients. So each week they do go to, they do visit the patients in their homes to either go and give them like IMs, injections, depots, or they go and check up on them, they go and assess their mental health state. Or there's a day that they also sit in the community clinic, and then the patient will rather come to the community clinic for their injections and all of that. And sometimes they also come for refill of their medications. Psychotropic medications mainly, they normally supply it for about 14 days. So when it's finishing, then either the community nurse have to send the patient more of that, or have to supply the medication to the patient in his house for the next 2 weeks, or the patient will rather come to the community clinic and then come and take the medication. So that's why in the OSCE we have community setting and then we have inpatient, so that it will be able to capture for the two side of the mental health nursing practice here in the UK. Now, when you're done with your implementation, giving your medication, the next one is evaluation. Evaluation, I don't know why, but I've had like about consistently about 4 students that have failed evaluation. Evaluation is very simple. It's just handing over whatever you have done in the assessment, in the planning, and then in the implementation station. Is what you have done that you are handing over to a next nurse. And in the evaluation, it could be that you are an inpatient nurse and you are handing over to a community nurse. So with mental health, as I said, some of them can be admitted. They can be admitted on the ward. They are treated. Their mental health significantly improves, and now we discharge them into the community. When we are discharging them, we don't just discharge them and then it's just like the physical health or the adult nurses what they do. That is not how it is done. Mostly we discharge them to a community nurse. So the community mental health nurse will also take over. All right. So the scenario can be that the patient has been treated and now he's being discharged. So you are the one who is on duty, hand over to the community nurse. Or it can be that you are also a community nurse. The patient came to the clinic for an assessment. You assess the patient and then realize that the risk of the patient, with the risk of the patient as it stands, cannot be managed in the community. Therefore, he needs to be admitted. And now you suggested an admission to the patient. The patient, when you suggested the admission to the patient accepted the admission. Therefore, you are now handing the patient over from the community clinic to the inpatient people, so probably to an acute ward or to a forensic ward or whichever ward you're handing over to, you are going to hand over to them. So it can also be in that scenario, or it can be that you are in the medical ward. The patient was assessed in the medical ward. He came. He didn't come for. It was not because of his mental health he came, but when he came to the medical ward or the A&E, they assessed and realized that this is more like or more of mental health issues. So they now did the assessment, and now you are handing over from that particular medical ward to a mental health ward. So depending on what the scenario is, you will know exactly who you are and who you are handing over to. And that is the number one problem that students are facing now. They just go, they read the scenario and then they start. Understanding the scenario is very, very important. Understanding the scenario alone is like passing half of that particular station, because if you don't understand the scenario, there's no way you'll be able to do what is required of you. So you have to read the scenario, understand it, and before you'll be able to hand over. And in handing over, they've given us an acronym, which is the SBAR: Situation, Background, Assessment, and Recommendations. So under situation, there is what you need to say. Under the background, that is what you need to say. Under the assessment, you need to say something, and in recommendation, they also expect you to say something, which are very, very specific to them. So if you go on the site, you can download the document and then you have a look at those ones. So it's just mainly you handing over the patient whatever you have done. And in the evaluation, you are giving back your assessment sheet, you are giving back your planning sheet, you are giving back your implementation sheet, so that will refresh your mind. If you've forgotten what you did because of exams pressure, that's going to refresh your mind, and then you are able to hand over to whoever is taking over from you. So that is that for the API, and that will cover for 4 stations, because APIE, that is 4 stations. So when you are done with that, then that goes away. But mind you, when you go into the exams hall, because API is the beginning, doesn't mean that you're going to start with API. The examiner can decide to let you start from anywhere he or she likes. They can let you start from skill stations. They can let you start from the professional values and evidence base, or they can let you start from the API. When they are letting you start from the API, it's just going to start from APIE. That one is non-negotiable. But if they want, they can let you start from any of the stations. So when you go in and assess, say you are starting with a skill station, don't be so much surprised. They can. It depends on them. Sometimes they do that to destabilize students, because students know that they are going to start with what? API, but they only go in there and then they ask them to start from somewhere, and that kind of destabilizes the students. But all in all, once you are well prepared, you should be able to do whichever station they want you to start from. Now, that is for the API. When it comes to the skill stations, we mental health nurses, we are very lucky, because we only have 6 skill stations to study. And out of these 6 skill stations, we are going to get 4 out of them. The 6 skill stations, we have physiological ops, we have suppository, we have nutrition. That one, you can also find these 3 in the adult nursing. Now, the ones that are very specific to mental health is talking therapies, reminiscence therapy, and de-escalation. So these are the 6 skill stations that you need to study. But then out of this, you are going to get 4. And we are also so lucky, because there is a skill station in there, which is de-escalation. It's supposed to be a skill station, but it's actually a written station, because you don't have to do anything for the examiner to see, or you don't have to demonstrate anything for the examiner to see. You walk in there, they give you your scenario, they give you your answer sheet, you sit down and you write your answers on the sheet. You are not talking to the examiner. So you just look at the scenario and write your answers out to them. And it is termed as a skill station. So we are so lucky that some of our stations are really, really, really easy. And about 99.9 students that have gone to take their mental health Osce have had de-escalation. About 99.9 of them always get de-escalation, which is very, very interesting. Yes, somebody's asking if de-escalation is writing. Yes, a writing station. It is classified as a skill station, but it's actually a written station. In reality, it is written, but it is under the skill station. You just write your answers. you read your scenario and write your answers. You don't have anything to do with the examiner. You're not talking to the examiner. You're not demonstrating anything. Just write your answers. And then within that 10 minutes that they are going to give you, at the end, you present your answers and then they are going to mark it. If you have captured everything that is supposed to be there, that's supposed to be in the marking criteria, most definitely you're going to pass. And most people, about almost 100% of people pass the escalation because all they need to know is what is their marking criteria. And it's as simple as that. And if you even look at the SIS, if we were even supposed to do all the SIS, it would have been very, very easy. For physiological ops, that's vital signs. Who doesn't know how to do vital signs? Everybody knows how to do it. I think now, some people fail physiological ops not because they were not able to do the correct thing, but it is the documentation. On the news two sheet that you have, sometimes people are under pressure and then they put the scores at where they are not supposed to put it. All right. They just go and put it somewhere that they are not supposed to put it. At the end, they fail. Not because they can't tie a cuff around somebody's arm to check BP, not because they can't put an pulse oximeter to check oxygen saturation, or even using the thermometer to check their temperature. They can do that. Or checking for pulse and then respiration. They can do that. But what normally fails them is the documentation. And the reason why people also feel the documentation is that I've realized that they waste a whole lot of time talking about unnecessary things whilst they are doing their, when they are tying the cuff on the arm and all of that. They are saying things that, they could have just skipped. So far as you check the arm and then there are no lacerations, there's no, there's no wounds, there's no cannula, and you're happy to use the hands. Once you are doing, just be doing it and be talking. But the student stands this way and talk about all those things. So you waste about 1 minute talking before he comes to pick the cuff. And when he picks the cuff and he wants to put it, he now repeats all those things that he was saying when he was just standing down, when he was standing that way. Meanwhile, while you were standing this way and then you were talking, you could have been pick the cuff and all of them be doing. By the time you are done talking, because this OSCE is about verbalizing it whilst doing it for the assessor to see. So whilst you are doing it, you are also verbalizing. And by the time you realize, the BP has finished checking, the pulse oximeter has finished checking, and then you can go on to check your pulse and then your respiration for that complete 2 minutes. And then once you are able to do that, you'll be able to finish in time. It is 10 minutes. So what I normally say is that by the time you are done with your BP, you are done with your temperature, and then you are done with your pulse oximeter, and you are still around 6 minutes, what it means is that you can use 2 minutes to count for your pulse and then your respiration. And when you add 2 minutes to the 6 minutes, that's 8 minutes. You can use 1 minute to do your documentation, and then you can use the other minutes to go through your documentation, or 30 seconds to go through the documentation to make sure that where you were supposed to put the BP, you've put in it. Where you were supposed to put the total score, you've put in it. Whether you were able to, where you write whether you are going to escalate or not, you have put in all that, and then you realize that yeah, you actually pass. But then people do it and they have like 30 seconds to do the documentation, so they rush and then they just the hand becomes faster than the brain, and then they put them at the wrong places. And when the reports come, they say that they didn't do their documentations well, and then they failed. So yeah, that's one thing about the physiological. The suppository is not also difficult, as well as the nutrition. So that one too is not difficult. I have videos on all videos on all of these on my channel. You can check them out. De-escalation, reminiscence therapy, and talking therapy are the cheapest. In fact, it's not difficult at all. These ones is just a matter of talking. If you just realize that mental health OSCE is all about talking. So far as you know how to talk, you are good to go. So those are the skill stations that you have to learn. So aside these 6 skill stations, please don't waste your time reading about insulin injection, reading about IM injection. That is for adult nurses, and that is what a lot of people are doing. I had somebody who wasted her time reading about adult. She went into the exams and was surprised, very, very surprised of the things that she was seeing, because those things she read about and all, they didn't examine, because that is not that is for adult nurses. So please don't waste your time reading about all those things. Read these 6, and then out of these 6, you are going to get 4 out of them. And now the last two, of course, which is professional values and evidence-based. That one It is the same whether it is adult nursing, whether it is learning disability, whether it is children's, OSCE, or it is the nursing associate OSCE. With the professional values and evidence base, is the same. So these ones, read the topics, all right? Take your time and read the topics that they provided you with. It is just a matter of knowing your mark. Here, if you don't read your marking criteria, there is no way you'll be able to write out the answers. And I've always said that merely you make up your mind that you want to learn the mental health OSCE, the very first thing you should do is that every single day try and read at least two of from evidence-based, read through, professional read through. By the time you realize you have gone over and over and over and over and over again, any topic that comes into your mind, you will see that you will be able to easily remember the marking criteria, and then you'll be able to write out the answers. But then there is some topics that constantly keeps on repeating itself in the mental health OSCE, so far as professional values is concerned and evidence-based. Something like honey dressing, key one. Female myocardial infarction, about 99% of people get that as well. I think saline, water against tap water, that one too also keeps on repeating itself. And then I think abuse also keeps on repeating itself. Social media is also keeps on repeating itself. So these are areas where you have to read everything though. So mostly I don't like telling people this. I want them to read everything. And when it's left like one or maybe even some few days to their exams, I tell them that even though you've read all these, but try and go over female myocardial infarction, try and go over abuse, try and go over social media. Those ones can they easily come or they keep on, you know, repeating themselves. So that is just the overview of the mental health OSCE. Aside this, please don't waste your time reading, assessment of dementia, assessment of psychosis, assessment of, schizophrenia. These are big mental health issues. If you want to, we can use one day to do an assessment for like paranoid schizophrenia, for example. You can't. So it's just depression and mania for the assessment. These are your focus. And then, as I've said, I've already gone through that with you. I'll answer some few questions that keeps on popping up on my YouTube channel. And then I've seen that some of you have started popping questions in the in the comment section. If you have any questions up to now, put them in the comment section and then I'll answer whilst I go on and then to answer the questions that I have here. So of course, the very first one is they normally ask, is the 20 minutes enough for me to finish the assessment station? Yes, it is more than enough for you to be able to finish your assessment station. Here, as I said, it's all about talking. Talk to your patient, know his risk factors. Whatever tool has been given you, like a PHQ-9, make sure you use it very well especially in the depression, because in the depression that they give a PHQ-9, fill the PHQ-9 with the patient, and then you'll be able to finish within your 20 minutes. And then I think I've answered the second question, which was the PHQ-9 that is given to you in depression, is it pre-filled? It is not pre-filled. You have to fill it with the patient. So the PHQ-9 that they are giving you in the depression, you would have to fill it with the patient. All right, you are filling it with the patient. It is not pre-filled. No, you are going to fill that with the patient. Then somebody also asks of Brandon scale, and then Glasgow coma scale. Please, this is not in mental health, all right? This is not in mental health. We don't do assessment of Brandon scale is used to assess bed sores, but that is not in the mental health OSCE. Yes, on the ward, you might use it, especially for those of you that when you get a job, you'll be going into the neurodiversity and neurology. Those are like old people who are stuck to the bed and they have mental health issues, or they have organic mental health issues. Organic ones are like something caused it, like maybe trauma, accident, they have a head injury, and then that is giving them a mental health issues. Because of that, they are bed bound and all of that. Yes, you might use it there in practicality, but then when it comes to OSCE, there's nothing like when it comes to the mental health nursing OSCE, there's like nothing like Brandon scale. There's nothing like Glasgow coma scale. So please, yes. And then somebody also asks of the implementation, how many medications are 7? Yes, so as many as they want you to serve. Yes, but mainly about 4 medications maximum. Some people even serve 2 medications, all right? So if you go and then the medications are 4 or 5 or 6 that you are serving, don't be surprised that probably you are giving the wrong medications or you are giving the patient an overdose. So for us, the medication is due your time and the prescription is correct. You have to, and the patient is willing to take it, you would have to give it to the patient. And yes, the next one was, are they all psychotropic? What are the type of medications and are they all psychotropic medications? Yes, of course. You'll be serving some psychotropic medications, or yeah, when we talk about psychotropic medications, they capture all the medications that are used specifically in mental health for mental health disorders, like the antipsychotics, like the mood stabilizers, and all that. Yes, you will have some psychotropic medications and you also have some physical health medications or some general medications as well. We all know very well that when you are on some psychotropic medication, they will have to give you some physical health medications, especially if it has got to do with you putting on weight and all of that. They can give you some medications like atorvastatin to help with cholesterol. If your cholesterol levels are high and you're putting on weight, it can come with that. They can also give you something like metformin to also help with your weight management. They can give you, in the UK here, unlike in Ghana, we were not using vitamin D or cholecalciferol because obviously we have the sun. Here, especially in the forensic services. When we talk about the forensic services, these are like um, hospitals where they detain people, all right? They are detained under a mental, here we use what we call the Mental Health Act, or we have a legislation for treatment and detaining people. So we have people that have committed crime. Instead of sentencing them into prisons, they rather sentence them to hospital. All right. So the judge sits on your case and says that you had a mental health issue and that is what made you to commit the crime. So I am sentencing you to a forensic hospital for treatment. As and when the doctors feel you're okay, they can decide to discharge you depending on the severity of the crime that you committed. So forensic services is just like you are in there with prisoners, all right? You are in there, all of them have offended, they've gone through Ministry of Justice and then they've been sentenced there. Or there are people who were in prison, they weren't feeling well, the treatment cannot take place in prison and therefore they push them or they refer them or they transfer them to forensic services. These people, they hardly do not go out because the place is a secure unit. So, they are locked inside. So when you are working there, you are walking around with keys and you are locking and opening, you can open the doors for them to go out. So because they are always inside there, they don't really get much of sunlight. So they, sorry, they can prescribe them vitamin D or they prescribe them vitamin D to help them to, to complement that. And then, of course, you can also have paracetamol and then the rest. Because if you have a mental health issue, doesn't mean that you will never get a physical health issue. So the patient is having headache, they give them, uh, headache medications like brufenes, like the paracetamol. So it's not only psychotropic medications that you'll be administering, you also be administering some other, physical health medication. So when you are studying, you have to make sure that you do study a lot around that. And I'm making a video on, mostly what I do is that all those that I've encountered or those that I've taught, when they come back, I ask them the medication. So I'm making a list and then I'll make a video on that. Uh, it can be illegal per, but then these are my medications I think you should study. So I'll just make a video on it and then I'll put them on my channel for you to have a look at them. So yes, and then I think aside that, these are the questions that a lot of people were asking me on my channel. The rest is just requests, just like Rajit has put that. Could you please give me some ideas about assessment with mania patients? Did you upload the part 2? I'm here to upload the part 2. Yes, so you are asking about the mania patients. Yeah, so with the manic phase in the assessment, mainly you are giving a patient who is manic, all right, who is manic. Just that some manic patient also comes with a bit of, when you're assessing them, they can be a bit delusional as well. There's some bit of delusions there. So sometimes they are much fixated on something. So you can go into the exams hall, you sit down with, and the patient is just writing. The patient is, when the patient is right, don't stop the patient from writing, because that is what they are. So far as you are speaking to the patient and the patient is responding, you are more than good to go. And in a mania, mostly they are characterized by elated mood or hyperactivity. This is what exactly manic patients are characterized by. And sometimes, as I said, it goes with a bit of, delusions as well. So in the exams, you are given this particular sheet which you have to, which is called the candidate note. It talks about capacity, it talks about relationships, it talks about adherence to medication, it talks about risk factors. So it's like a guide for you. So when you get to relationship, you have to ask the patient about relationship, so how is your relationship with your family? Are your family supportive enough? In your situation now, have they been supportive enough? How are they supporting you? So when it comes to relationship, that bit, when it gets to medication, you have to ask them, I can see that you're on some prescribed medications. Do you know the medications you are on? The patient will tell you. Then you probe further, you explore further. So have you been taking them as prescribed? And if it, fine. If you are not taking it, you have to still explore further. Why are they not taking it? They are going to basically tell you, mainly it's just two things. Either I'm not very comfortable with what the side effect I get from the medications, or I just don't know what the medication is doing for me. That is lack of knowledge. So mostly if your problem is non-adherence to medication, mostly you know, these are the two things that you can relate it to, or the patient is going to tell you about. And then when it comes to self-care, you can also ask them about, in terms of their personal hygiene, whether they've been taking care of their personal hygiene or not. Why are they not doing it? If they are doing it, that is okay. If they are not doing it, why are they not doing it? In mania, most of them might not do it because they feel they are, especially when it comes to delusions, they are so much fixated on something that they don't even have time. So some of them can tell you that, especially when you meet women, all right, or when you meet ladies who are your patient, they can tell you that I'm getting ready to marry the richest footballer in the world. And then they can even mention a popular footballer's name like Ronaldo. So I'm busy putting things together and all of that. So because of that, they are just moving up and down. As I said, the mania in the exams, or the patient can even stand up. You are speaking to the patient, and all of a sudden the patient will say, get up. If the patient get up, and that no circumstance should you also get up. Immediately you get up, there's no difference between you and the patient. All right. So when the patient gets up, the patient will intentionally ask you something. They are just trying to show you that they are what? Hyperactive. They are elated. Can I get you a cup of coffee? At that point, you have to decline um, in a very respectful way, and then ask the patient in a very respectful way to sit down. If the patient can have a seat so that you can continue. When you are done, probably the two of you can have, a cup of coffee together. And once you say that, the patient would automatically sit down, and then you can continue your assessment with it. So the mania, just make use of your candidate note, look at the topics that are on it, and then based on that, you'll be able to ask the patient questions. And mostly they give you overview of the patient history, which is also going to tell you exactly the type of patient that you are dealing with, um, the presenting complaints, what made the patient go to the GP, and the GP also referring that particular patient to you. So mostly what I tell people is that before you even start your assessment, make sure you just take a look at the presenting complaints. It would tell you this patient has been hyperactive for the past few days. He has not been sleeping. He has had cuts on his feet, which has left him with wounds. He's just been moving about. He's not sleeping much. So it will give you all this. So it's like you have a bit of information about the patient already before you even start. So you can look at some of this information, and then you can throw the question back at the patient to explore further about it. I can see that you are not sleeping, you've not slept for the past, or I can see that you are having issues with sleep. How many days haven't you have a sleep? They will tell you, why are you not sleeping? They are going to tell you, so that if you have a sleep as a problem, if the patient is experiencing sleep difficulties as a problem which you want to use in your planning, you would have explored the reason why the patient is not sleeping, so that the problem, the nursing problem or the patient problem, you can say that patient A B is experiencing difficulty in sleeping related to then whatever the patient, or whether it's the hyperactivity, whether it's the elated mood, whether it is the depression, you can, link it to that. So it's just a matter of you looking at the presenting complaints and then also go down to their social history. One thing that students are not doing now is that they are not taking the social history of the patient into consideration when they are doing the assessment. Look at it. Because if you have a patient who has just who got married last year, the wife has just given birth to a 4-month-old baby, and he's now very hyperactive. He's now manic, and he's taking alcohol. And when he takes alcohol, he becomes aggressive towards the mother, and then the baby, the 4-month-old baby. You did not read this, so you don't know. Now, when it comes to, you matter how good your assessment was, if this was the case, 4-month-old baby drinks alcohol when he's very manic, he abuses them when he's manic. This particular patient, if you leave this particular patient on the community, you have failed in advance, right? So you have to always look at the social history. That will give you a clue as to whether, it will give you a clue to the risks surrounding this patient, and whether this patient I should admit this patient, or I should suggest an admission to this patient, or this patient can still be managed in the community. And based on that, you can make a very good judgment out of that. And then, you'll be able to either admit, or you just leave the patient on the community for continuity of care to take place. So it's very, very important that that particular sheet, which says overview of patient history, please, before you even start your whole station, your whole assessment station, please make sure you go through it. There will be some very good points there. When you pick it up, it will help you to be able to ask the relevant questions that you are supposed to ask. If are there any other questions, please throw more light on implementation station. I guess the most difficult. Yes, I've I've already talked a lot about the implementation station. It is not now. Let me see. I'm trying to get your name. Sorry. Oh, it's celebrity. Some sorry if I'm getting your name wrong. But then honestly, now people are even passing implementation station more. Now the stations they are failing more is assessment and evaluation. Evaluation used to be the cheapest, people were passing it, but now they used to fail a lot of the implementation, and now people are just focusing on implementation. They are passing implementation, and they are now rather failing, assessment and then evaluation. All right. So the implementation, is just administration of the medications. All right. As I've said, you'll be administering some psychotropic medications and also some physical health medications. So it's not all going to be mental health medications alone that you'll be given. Psychotropic medication and then some physical health medications as well. And it can either be a community setting or it can be an admission-based setting. Admission-based means the patient is on admission at the hospital. Community means the patient is coming either to the community clinic for you to give the medication, or you're going into the patient's house to go and administer the medications. And in all this, you will have a prescription with you. So you have to make sure that the prescription bears the name of your patient, so you confirm the name of the patient. You have to make sure that the medication that you are going to give, in the scenario, they are going to tell you exactly the times that you'll be giving the medication. You are a so nurse on acute mental health, give 12 o'clock medications, all right? If it is 12 o'clock medications, make sure when you're going to the prescription, you are looking for the medications that are due at 12 o'clock, and those are the ones you'll be administering. And if it is due at 12, you are not just going to give it, you're going to make sure that that particular prescription is correct. So when you're reading the prescription, there are some things that some information that needs to be on the cardex or the prescription to make sure that to make that particular prescription valid. Something like the doctor's blip number, his signature, and his name. If these things are missing from it, then it means that the prescription is incorrect. Or something like the right tablet, sertraline, and now which is an antidepressant. And now when you go to the form of it, they write per eye. all right, the root of the administration, and then they write per eye. You can't give a tablet through the eye. So basically, that particular prescription is what? Incorrect. So you get, don't assume. One thing that I have to tell you is that don't assume. All right, don't assume. For instance, they are giving you know that adult dosage for paracetamol is 1 gram. All right, mostly it's, even though they use the weight in working it out, but most adults will take 1 gram. Now you know that 1 gram is translated as what? Thousand thousand is it 1,000 milligrams? All right, 1 gram is translated as 1,000 milligrams. Now you go into the exams and then uh you go into the exams and then you have, let's say, instead of 1,000 milligrams, they write 100,000, all right, or they write 1,000 grams, 1,000 grams. Don't assume that they forgot the M. That is what one student did. The student said, "Oh, she thought they wanted to write, 1,000 milligrams, and then they wrote 1,000 grams." Right? They know exactly what they are doing. And one thing about these exams is that if you are not sure of anything, especially in the implementation on the prescription, make sure you ask the assessor. And the assessors have funny ways of answering you. If you ask the assessor and then the assessor said, that is what it is, and then he will just sit down and then he will look somewhere else. If the assessor tells you that is what it is, then that is what it is. It is 1,000 gram, not 1,000 milligrams. So that particular prescription is what? Incorrect. As simple as that. But then if the assessor says that consider it corrected and it is, then he will now mention the correct one to you. For example, when you are reading the prescription, it has about 4 or 5 sheets, something like this, about 4 or 5 sheets together, right? And when you're reading the prescription, any sheet at all you open, you make sure that that sheet remains the same for the patient. So the patient's names are on all the sheets. So on this sheet, you find the patient name, on this sheet, you find the patient name, and then on the third sheet, you find the patient's name. Now, you read this one, that has the patient name. You read this one that has the patient. But the third one, you reach there and then the name has changed on that particular sheet. At that point, don't assume that this sheet belongs to the patient. You have to verbalize, assessor, I can see that the name on this particular sheet is not that for my patient. So I'm going to take it out. Immediately you say this, if that particular prescription was supposed to be for the patient, the assessor verbalize that, consider it as uh, as it belongs to what? Your patient. Or consider the name on it as, then the assessor will mention the name of your patient. When the assessor mentions that, what it means is that now this sheet belongs to your patient. But I can say that this sheet does not bear the name of the name of my patient. The assessor says that that is what it is. Then you just take that one out. You have no business with that particular sheet. So don't assume that they made a mistake, so you are correcting them. There is nothing like they made a mistake here. If they made a mistake, yes, that is up to them. Just take it out. Make sure you confirm always with the assessor, and then the assessor will give you the confirmation that it is this or it is that. Don't always assume. That is it. Any other questions? Blessing, I can hear you. Yes. Any other questions? If you have any other questions, you can pop it in the mental health care plan so that we can download. I have a link, Kelly's. I have a link under the video that I did. I've basically drafted the care plan for you. In depression, all the problems with their interventions is a complete care plan, and then in mania too is a complete care plan. So yeah, there's a link under the video I have created. Just click on the link and then you'll be able to download it. Okay. Yes. And I'm not too sure, but under one of the videos, the most recent video that I did, yes, there's a link under it. Yes. Any other questions? Any other questions? Yeah, so those that are planning to come in and come and do their uh, self-sponsorship, yes, if you come in, my videos are there, you can watch them. If you need any tuition too, you can also send me an email. You can also send me an email. I'm trying to put my email in the in the comment section, send me an email, and then when it comes to jobs to try nowadays, there are, this one is a bonus, for you. Try and search for jobs in the prisons, right? Now the trust is kind of very difficult to find jobs there. Try and search for jobs in the prisons. It's not scary there, all right? It's not scary. Try and search for jobs. You can easily get jobs there. And then after 1 or 2 years, if you are not okay with it, you can switch back to, by that time you are done with your Osce and everything. And one thing about those prisons is that they everything is fast, 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 fast. All right. So when you get in, they are not, some people in some trust, they are going to teach you for like 6 months and all of that. The prisons, no, they need you quick to get your PIN to be able to do their medications. So they just send you to a place where they teach for like a week. The next week, within 3 weeks, you've written and then you've had your PIN. And with mental health, so far as there's pressure on you to learn or you are willing to learn, you can easily pass it on first attempt. So yeah, try and look for jobs in the prisons. You'll be able to secure a job there because nowadays it's very, very, very difficult to get a job. Even if you come here and write and then you have your PIN, it's not a hospital that is bringing you in, or it's not a care home. The care homes are also good. Their rates are good. All right, those that want money, go into the care homes. Yeah, just that. In terms of your career, there's a whole lot to learn about the mental health. It's when I came here that I realized that mental health is very broad. It's very, very broad. It's not kind of limited, it's very broad. So in the NHS or in the hospitals or in the private facilities, they kind of offer you the opportunity to expand your horizon or to develop. But in the care homes, they just need you to get your PIN and then just do the medications and all of that. And their rate is also good. So if you're looking for money, yeah, go into the care homes. But if you're looking for more of career progression and all of that, try the NHS and you would enjoy it because there is kind of very, very, very interesting in the NHS when it comes to mental health. Yes. So if there are no questions, then I just we're going to end it here. And I must say that thank you very much, all of you, for joining the live. And I'm very much grateful to you. I've gotten 1,000 subscribers now, and I've seen some small, small $1, $2 coming in. It's good, it's good that uh, you are sharing the knowledge you have to people. It's impacting on them. They are watching videos, they are passing, and now you are getting some small, small reward for that. I'm very grateful to all of you for always sharing the videos. And then I'm going to upload a video on mania, which is the actual one. I have a video on depression, the actual one where we did it. I've done the actual one for mania now, and I'm going to upload that. A lot of people have been asking for that. I'm going to upload that, and some of you have also asked me to break down the questions, how you are going to ask your questions in the assessment, how you are able to ask your questions. All right. So I'm going to take time and then I'll break the questions and how you'll be able to ask your question. I'll put them on a sheet of, I think I have a document on that. And when I'm done with this, and I always put the link under it, and then you can click to download the questions so that you can familiarize yourself with the questions. Just pick them and then make it your own. All right. And then you are able to ask the relevant questions when it comes to the assessment. Yes. So on this notes, I've seen a lot of thank yous in the comment section. Thank you very much too for joining the live, and um, I'll keep on uploading the videos. And God bless you all, and thank you for joining the live this evening. Thank you, and it's going to be a bye for now.